Hey guys, this is LJ with HEARTSTART.NOLA.com, and today we're talking about calculating medication infusion rates, otherwise known as calculating IV pump rates. So medication pumps are a great tool that can be used to ensure precise and consistent medication administration to a patient while transporting or throughout our patient care. Many medication pumps have built-in calculation features that limit our need for manual calculations if standard concentrations are available. Medication pumps generally pump a maximum of 999 mils per hour. So additional calculations may be needed if an infusion is longer than or shorter than a 1 hour time period. If your medication infusion takes less than an hour to complete, you may need to tell the pump to speed up the infusion to fit the desired time. This is done by increasing the milliliter per hour rate on the pump. For safety, always remember to set the maximum infusion volume by setting the volume remaining on the medication pump and resetting the volume infused on the counter. To calculate the milliliters per hour when the medication infusion is less than or greater than 60 minutes, use the following formula. It's our volume in milliliters multiplied by our time coefficient, which is 60 for 60 minutes, and then we'll divide that by our desired time in minutes. That'll give us our milliliters per hour for our IV pump infusion. Let's look at a practice problem. A magnesium sulfate infusion is indicated for an eclamptic seizure patient and is to be administered over 10 minutes. The magnesium sulfate infusion is prepared as 4 grams of magnesium sulfate and 100 milliliters of normal saline. We'll set our formula up, and you can see we have 100 milliliters for our volume. We'll multiply that by 60 for our time coefficient, and we'll divide that by our total time in minutes, which is 10. When we calculate that, we'll set our pump at 600 milliliters an hour to make sure that we give our magnesium over 10 minutes. This time, we have 4.5 grams of Zosyn that's indicated for a patient with community-acquired pneumonia. The Zosyn is supplied 4.5 grams and 250 milliliters of normal saline and is to be given over 30 minutes. We'll set our formula up, and you'll see we have 250 milliliters for our volume. We'll multiply that by 60 for our time coefficient, and we'll divide that by our total time in minutes, which is 30. We'll calculate that, and we'll see we'll set our pump up at 500 milliliters per hour to make sure that we give that Zosyn over 30 minutes. If your medication infusion takes more than an hour to complete, you may need to tell the pump to slow down the infusion to fit your desired time. This is done by calculating the milliliter per hour rate to fit the desired time in minutes. For safety, always remember to set the maximum infusion volume by setting the volume remaining on the medication pump and resetting the volume infused on the counter. For this problem, we have 4.5 grams of Zosyn that's indicated for our patient with community-acquired pneumonia. This time, our Zosyn supplied 4.5 grams and 100 milliliters, and we're going to give it over 4 hours. So the first thing we're going to have to do is convert our hours to minutes for our total time in minutes. We're going to do this by multiplying 60 minutes times 4 hours, and that's going to convert our 4-hour order into 240 minutes. We'll set our formula up for our volume, which is 100 milliliters, multiplied by 60, which is our time coefficient, and then we'll divide that by our total time in minutes, which is 240 minutes. When we calculate that, you see we get 25 milliliters per hour to make sure we give that Zosyn over 4 hours. If you find yourself frequently giving medication administrations on a pump that's less than an hour or more than an hour, we recommend that you get a quick reference chart. This will allow you to quickly start an infusion without having to do the math every time. Most commonly, infusions are given less than an hour in 10-minute, 20-minute, or 30-minute intervals, or greater than an hour in 2-hour periods, 4-hour periods, or 8-hour periods. Thanks for stopping by with us today. We hope you learned something. Please see the show notes and visit HEARTSTART.NOLA.com for HEARTSTART NOLA reference cards, guidebooks, and other great stuff to help you with your pre-hospital, emergency, or critical care needs. This is LJ with HEARTSTART.NOLA.com saying, see you next time.